So far, I only mentioned the somatic nerves as they enter or exit the spinal cord. However, we know that there is another aspect of the nervous system, and that's the autonomic nervous system, which delivers sensation from organs, viscera, and controls smooth muscle, cardiac muscles, organs, and glands. Let's add them to this system. So the sensory fibers, which come from organs and viscera, will enter into the spinal cord together with other sensory nerves. However, they will terminate in the lateral side of the gray matter in the spinal cord, as opposed to the arriving to the posterior horn. The motor fibers of the visceral system or autonomic nervous system are present in the lateral horn. And please note, as I mentioned before, that lateral horns are not present in the entire length of the spinal cord, just certain areas, namely from T1 to L2 and S2 to S4. So when the lateral horn is present, autonomic motor neurons are present in the spinal cord. These nerves will send their axons together with their somatic counterparts through the ventral rootlets. And then they join together in the spinal nerve. So again, in many of the spinal nerves, at many segments, there will be somatic sensory, somatic motor, as well as autonomic fibers present. The root of the autonomic motor fibers are a little bit different from those of the somatic ones. As mentioned before, the somatic motor fibers, which are in the spinal nerve, will be sorted into the dorsal and ventral rami to reach their target, to the dorsal, the back muscles and skin, or the rest of the body, so the major muscles in the body. However, with the autonomic fibers, it's a little bit different. The autonomic motor fibers, as I mentioned before, will be in the spinal nerve, but then before the divergence between the dorsal and ventral rami, they will first synapse onto another neuron. These neurons are sitting or housed in another ganglia, as typically cell bodies, when they are grouped together, they will be grouped in a ganglion, in a peripheral ganglion. So this ganglion is an autonomic ganglion, and the fibers which are coming from the spinal cord to this ganglion will be described as preganglionic fibers. And the neurons will be preganglionic neurons. In the ganglion, there will be synapsing between the preganglionic and the postganglionic neurons. And then these postganglionic neurons will return back to the spinal nerve and will be divided into the ventral or dorsal rami to innervate the skin or the smooth muscles or organs as their target. The rootlets, which are formed by the preganglionic fibers, are named the white rami, white ramus, and the rootlets which are formed by the postganglionic fibers are the gray rami or ramus. In this picture of the spinal cord, and specifically the spinal cord rami, we can follow as the spinal nerves are leaving, and some of them will go into this ganglion, and then the postganglionic fibers join back again with the spinal nerve, and in this case the spinal nerves will form the intercostal nerves. Since we can see the intercostal nerves, that means that we are in the level of the spinal cord where T1 to T12 spinal nerve segments are formed. Thereby, this ganglion has to be concerned with the sympathetic output of the spinal cord. This ganglion is a sympathetic ganglion. And as you can see, there is a whole line of sympathetic ganglions here, and because they are connected with fiber bundles, so this is another ganglion, this is another ganglion, and they are all connected through autonomic fibers, they forming the sympathetic chain. Though the spinal cord seems at first glance like a one uniform tubular structure, it is not so. As I mentioned before, for example, autonomic output, input and output from the spinal cord are only present at certain levels. As mentioned before, we have either at T1 to L2, these are sympathetic, and S2 to S4 for parasympathetic.